Greetings, Professor. My name is Yan Lim, and I would like to start my second presentation about case studies. First of all, I would like to introduce to you the case of Margaret. Margaret is a 32 years old lady who came to counseling through a referral, and before coming to the therapy, she read about cognitive behavioral therapy and think about it very positively. Her behavior toward the therapy is very hopeful because she believes that she could overcome this generalized anxiety disorder through counseling and through this therapy. In this therapy, there were about 5 sessions with therapists, and therapy provided cognitive and behavioral techniques. I would like to start with the triggered event that created anxiety to Margaret. According to her, it started a year ago when she was shopping, and then suddenly this anxious and nervous feeling came to her. And then, however, at first time, it did not last long. After a few minutes, she was able to continue with her shopping. But 2 weeks later, when she was out to shopping again, she experienced worse anxiety than before, and it made it difficult for her to go outside and enjoy shopping. We could find out that she's going through an anxiety by looking at numbers of symptoms. According to Margaret, she has difficulties in controlling worries and her mind going blank while shopping. She also states that she could even hear her heart beating, which means that she's experiencing muscle tensions and trembling. Her generalized anxiety disorder may include social phobia and agoraphobia, which is being afraid of what others might think of Margaret. And this anxiety began with panic disorder in the beginning. And this made Margaret to have difficulties being with the others, strangers, or going outside of her house. However, Margaret tries some of the maintenance process to calm herself down whenever her mind gets blank and involved with anxiety. When she panicked during her shopping, she tries to remember some self-guidance that she has read from internet. She tried to remember that nobody actually really cares about what Margaret is doing. Everyone is just busy with their own stuffs. And this helped her going inside and continue with her shopping. But still, she says she feels anxious before going outside of her house. So I would like to talk about the cognitive techniques that were used and that could be used. First, the therapist tried to help Margaret modifying the negative thoughts and helped Margaret to practice self-thinking in positive ways. So therapists tried to tell Margaret that she had to change her negative thoughts into positive thoughts. So since cognitive techniques are dealing with thinking process, it is necessary to help the client about how and what they are thinking. Together with cognitive techniques, there were some behavioral techniques that were used in the therapy. These 2 different techniques were combined and became better techniques in my opinion. The therapist told Margaret to keep a thought record whenever her thoughts were negative, so she could know the schedule of her anxiety and may predict of her anxiety. Also, the therapist used systematic exposure of her anxiety by encouraging Margaret to go to the supermarket where the loss occurrence happened each day. And whenever she gets anxious and nervous, try to focus on breathing and positive self-talk whenever she felt anxious. This is known as systematic desensitization and relaxation skills. We should also help Margaret to develop the ability to accept imperfections and mistakes, because when she tries to do with self-thinking and tries to practice overcoming this anxiety, she could make mistakes or she can even fail with it. But we should let her understand that failing one time is not a total failure. And we should encourage her with encourage her to overcome with keep on practicing with these exposure techniques. However, therapy with Margaret seems successful because she tries to cope and read continually. Margaret has a will to carry out homework tasks and keen to be active in the change process. We can see that Margaret wants to change herself. She wants to escape from this anxiety. So we could look forward with Margaret overcoming her anxiety. Thank you for your attention.